So, today, we're diving into Dorothea Orem's self-care deficit theory. We'll explore her theory that centers about empowering individuals to care for themselves. So, let's uncover the core concepts and discover how it shapes the way nurses work with patients today. So, Dorothea Orem was a prominent nursing theorist who made significant contributions to the field of nursing. Born June 15, 1914 in Baltimore, Maryland, she passed away in June 22, 2007 in Savannah, Georgia. Her parents were Benjamin and Adelaide Orem. Her father was a bricklayer and her mother was a homemaker. Orem developed a keen interest in nursing care from an early age. Orem's educational background played a crucial role in her development as a nursing theorist. She pursued her nursing education at Providence Hospital School of Nursing in Washington, D.C., and later obtained a Bachelor of Science in Nursing Education from the Catholic University of America. Orem went on to earn a Master of Science in Nursing Education from the Catholic University of America and a Master of Arts in Education from Teachers College, Columbia University. Dorothea Orem's definition of nursing emphasizes its therapeutic role in sustaining life. Dorothea Orem's nursing consists of three key steps. Firstly, it involves determining the underlying reasons for a patient's need for care. Secondly, it entails designing a nursing system and developing a plan for delivering that care. And finally, the process involves the management of nursing systems, encompassing the planning, initiation, and control of nursing actions to ensure effective patient care. So, Dorothea Orem first published self-care theory in 1959 as a result of working towards her goal of improving the quality of nursing in general hospitals in her state. So, this theory focuses on each individual's ability to perform self-care, defined as the practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being. So, the provided diagram elaborates on components within each of these theories to provide a more comprehensive understanding of Dorothea Orem's nursing framework. So, self care refers to the actions and activities that individuals perform independently to enhance and sustain their personal well being across their lifespan. Self care agency is the term used to describe an individual's capacity and ability to carry out self care activities, the self care requisites, or the self care needs. So, these are the actions or measures used to provide self care. So, this theory consists of three categories: the universal, the developmental, and the health deviation. Therapeutic self-care demand. Totality of self-care actions to be performed for some duration in order to meet self-care requisites by using valid methods and related sets of operations and actions. The next theory is the self-care deficit theory. It is the central focus of Orem's grand theory of nursing. So these are the five methods of nursing help. So acting for and doing for others. The next one is guiding others. Next is supporting another. Follows the teaching another. Next is the providing an environment promoting personal development. So the next and last nursing theory is the nursing systems theory. It is the ability of the nurse to aid the person in meeting current and potential self-care demands. So we have three support modalities: the wholly compensatory system, and the next one is the partly compensatory system. Lastly is the supportive system.
So next, we are going to talk about the components of the theory in relation to the four nursing meta-paradigms. So the first meta-paradigm is person. So according to Oren, human beings are very much different from other living things in terms of their capacity. Humans can reflect upon events themselves and their environment. So under the person is a total being with universal developmental needs and capable of continuous self-care. A unity that can function biologically, symbolically, and socially, and it has the capacity to reflect, symbolize, and use symbols. A nursing client is a human who has health related or health derived limitations that render him incapable of continuous self care or dependent care or limitations that results in ineffective or incomplete care. A human being is the focus of nursing only when self-care requisites exceed self-care capabilities. So the next meta paradigm to be discussed is environment. So RM's view of health as a phenomenon affected by inseparable entities shows her view of the surrounding environment as an external source of influence in the internal interaction of a person's different aspects. Health. So RM supports the World Health Organization's definition of health as the state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. The wholeness or integrity includes at which makes a person human operating in conjunction with physiological and psychophysiological mechanisms and a material structure and in relation to and in interacting with other human beings. So the next meta paradigm is nursing. So according to RM, nursing is helping clients to establish or identify ways to perform self-care activities, actions deliberately selected and performed by nurses to help individuals or groups under their care to maintain or change conditions in themselves or their environment. The goal of the nursing is to render patient or members of his family capable of meeting the patient's self-care needs. Number one is to maintain a state of health. Then next is to regain normal or near normal state of health in the event or disease or injury. Then to stabilize, control, or minimize the effect of chronic poor health or disability. The next is the application of theory into nursing process. So first, the situation here is Kuya Eddie, a 45-year-old jeepney driver, suffered a vehicular accident along the highway of EDSA after an almost direct collision with a delivery truck. He was lucky though, having been found still alive by the paramedics and rescue squads upon their arrival. He was rushed to the hospital where he was given emergency treatment for severe blood loss. Eddie's lower left leg was torn off upon impact. Upon examination by the physician and nurse, it was revealed that he suffered complete fracture of the leg, severe injury to the right inner thigh and foot, massive muscle damage, and head injuries. Emergency surgery was initiated to repair extensive damage. After the surgery, though, Eddie went into a coma due to a developed blood clot on the brain. Another operation was done to remove the clot, and it was very successful. Eddie, however, did not wake up after surgery. The physicians are starting to give up on him, knowing that few patients manage to recover from a comatose state. His family prayed for a miraculous recovery. Then, after a month, he woke up. His body, however, became like a vegetable. The physicians said that Eddie would be paralyzed for life, but he, being a man of faith, did not accept this. Walang imposible sa Diyos, Doc. Halang ang paniniwalaan ko ng lubos. He told the medical staff surrounding his bed. Every day, with a desire burning in a focused mind, he willed himself to walk. Eddie imagined himself walking and held that mental picture as the nurses did range of motion exercises, massaged, cared, and cleaned his body. After a few months of therapy, the attending physicians were stunned. One morning, Eddie suddenly sat in the bedside. It was a miracle. He could move his legs, a little at first, then some more, until after a few weeks, he could stand and walk with a limp. The physicians ordered that the patient be given and ought the use of crutch as assistive device. Lisa, an orthopedic nurse, was tasked to perform health teaching and guidance to Kuya Eddie. So that was the situation. The next is the assessment. Keeping Orem's self-care in mind, the nurse would then identify probable needs and evaluate the client's potential for independence. Nursing care would start at the patient's wholly compensatory state, which is a form of comatose paralysis. Then it would proceed to partially compensatory state, wherein the client is taught the use of assistive device to aid in mobility, posture, and pacing. The client's support system is also taken as an important consideration, including Eddie's perception of a disability and possible lifestyle adjustments and consideration. The next is the diagnosis. So the diagnosis is self-care deficit related to total paralysis and knowledge deficit related to the use of crutches. So the implementation is to assess the client's perception on disability, lifestyle changes, and coping mechanisms, demonstrate the use of crutch, walking and pacing using visual aids, proper therapeutic communication, and demonstration. The family or loved ones should be involved on the discussion and address their questions and concerns. Refer the client to physical therapist for collaboration and further guidance. Then ask the client to demonstrate knowledge and competency to evaluate self-care capacity. Then the last is the evaluation. The nurse, together with the patient, after a few days of instruction and counseling, would agree on whether the goal is met or not. Eddie would then be encouraged to set new goals for himself.
So we are now heading to the strengths and weaknesses of Dorothea Orem's theory. So first one is the concept of self-care and health maintenance are congruent with contemporary literature in healthcare. Second one is the theory can be used in multiple nursing specialties. It pertains to nursing profession for both beginning clinicians and experienced clinicians. The concept develops an integrated nursing care strategy that adapts to the patient's necessities along the recovery period. Provides comprehensive basis for nursing practice and has utility for professional nursing. So weaknesses. Orem self-care deficit theory may not encompass all aspects of care and needs of specific client. So like any nursing theory, it provides a general foundation and perspective, but it may not fully capture the complexity and diversity of individuals' care requirements. Second one is time-consuming for nurses. Third is direct contact is necessary throughout the nursing process. Does not address cultural needs. The last one is multiple levels of the theory to consider. Self-care, self-care deficit, and self-care deficit potential. So by understanding these levels, nurses can provide appropriate care, support, and education to promote self-care and enhance the individual's well-being. Contribution of Dorothea Orem. Dorothea Orem helped publish the guidelines for developing curricula for the education of practical nurses in 1959. So this publication provided important guidelines and recommendations for developing educational curricula specifically for practical nurses. Orem's nursing concepts of practice, which details her nursing theory. The self-care deficit theory of nursing was released in 1971. Third is served as chairperson of the Nursing Development Conference Group, and in 1973 edited that group's work in the book Concept Formalization in Nursing. In accordance with Orem's self-care deficit theory, patients are more likely to recover when they retain a certain amount of autonomy over their own self-care. Lastly is Orem identified the three types of practice of nursing science in nursing systems. So we have three: the wholly, partial, and supportive. Wholly compensatory system consists of complete care to the patient and is not able to perform any of their self-activities. Partial compensatory system. Both nurse and perform care measures or other actions involving manipulative tasks or ambulation. Last is supportive educative system. The person can perform or should learn to perform required measures of externally or internally oriented therapeutic self-care, but cannot do so without assistance.
So, for a little refreshment, we'd like to ask you 3 questions related to our report. So, these questions help us gauge your understanding and spark a discussion about the key points that we've covered. So, first one is, what are the 3 support modalities in nursing systems theory? So, please provide one example for each. Number 2, how did the self-care deficit theory evolve within the nursing field? Last, what is Orem's view of nursing within the nursing meta-paradigm?